Hello, good afternoon and welcome. We are excited to have you join us for our next 90-day live treatment for hyperpigmentation. So it's been a few weeks since our last treatment, which was a post follow-up from her mid-depth peel that she had, and everything went really well with that. We put her on post care for a couple more days and then her regular kind of home care regimen to support what we're doing. She's been using the Natural Mega Brightening Serum and the Chronopeptide A along with her cleanser and moisturizers and all of that. How is your skin doing? How would you describe it, and how's everything going?
Really good. It's feeling better than I expected.
Yeah, good, good. So, and everything really, you know, still looks good. She did get a little breakout here on her cheek that I don't know if you can see that yet, but when we get into the treatment, our plan today is to go into another mid-depth. There's a lot of different directions that you can go in a program like this and with a skin that you're dealing with pigmentation. Could you go to a deep peel? Do you want to stay progressive? And can we go further, you know, with a mid-depth? The mid-depth peel is kind of the ideal thing right now for her and what we're trying to do, especially to get movement, which I do feel like I'm seeing this. I don't know if you guys do yet and if we can totally see this, but I feel like around her eye that it has lightened a little bit, and even on this side, much more, but it is very dense, and it's much, it's gonna take a lot more work to move some of this pigmentation that she has and that we're dealing with. We're certainly getting some good clarity in her skin. We're getting overall rejuvenation. A lot that's going on with her skin is looking better and better. But to kind of go forward, you have to really see, you know, how did they peel? You know, how did they go through that peel? Where do you need to stay at? Because you can do some progressive peels close together and get some really good results in movement. Or you can go into that mid-depth. We've kind of progressively moved her along into a place where really she's pretty much ready for a true mid-depth. Maybe even a mid-depth plus if we wanted to go there. I don't think I would go deep with a skin tone like her. It's one of those risks that you have sometimes when you're dealing with a higher Fitzpatrick, that maybe you could, as you really see more with the mid-depth again and how her skin's peeling. If she's picking, make sure no other pigmentation rose to the surface, anything like that. But in general, you don't have to go that far. That creates a lot more heat in the skin, and the skin receives a lot more damage when we go to a deep peel. So more and more healing with a higher Fitzpatrick, you have more risk with that pigmentation. So really, there's times when we're dealing with a Fitz 1 or 2 where we might go to a deeper peel if we needed to for this type of condition of having pigmentation being our focus. But with a higher Fitzpatrick, we really don't need to go there, and I think we'll still get what we're looking for. So being able to do a true mid-depth today, I think is going to kind of take her to that next level. Then we'll see, we're on treatment 5, which how far is this into the, are we at 7,
we're
8
around
weeks?
like around 7 weeks.
Yeah. A little over halfway, I guess, into her series. So we'll see from there whether we want to begin to taper off into a lighter peel and then a really nice kind of lightening type facial for healing and nutrients to end. But we'll kind of take that and play that by ear. This will be her 3rd peel today, and I think well, she's up for it. You know, I did ask her right before we started, how do you feel about going even further than we've gone so far? And she was like, yeah, I'm up for it, I can do it. And that's always good. You want to get compliance from your client too, obviously. During this 90-day though, allow yourself the room to be able to go from progressive, mid-depth, and deep. And so you want to give yourself the ways that you can really read the skin and make the appropriate steps and decisions along the way. And that's what we're trying to do here. So it's not a set system in that way. Typically you can at least do 3 peels, a lot of times 4, depending on the skin condition. And as you've watched the others that we've done so far, seen some variation there with the acne and the aging. But give yourself that room and to be able to talk with your client and really see what level you need to go to for each different treatment. So we're going to get started with the mid-depth. What we're going to do though, we've noticed in general, and we've talked about this with sometimes Asian descent, AHAs are not always the best for their skin. Doesn't mean they can't be used on that skin type, okay? So don't think that. They can be used, and sometimes they can be helpful to certain levels, particularly in the treatment room if you're just leaving it on for a few minutes or something like that. But in general, we find that salicylic many times can be a better acid for them, mandelic, and then certainly TCAs work really well when you're getting up into deeper peels. Her skin, with having more enlarged pores and things like that, and a little more oil to her skin, has done really well with salicylic as an option. So what we want to do, though, is we want to use that AHA component to what the Melanin Lift is primarily your 15% TCA and AHA. We're going to do a modified version of the Melanin Lift, and that's kind of our focus, and then we're bringing that in. So we're going to take it down a little bit and use the 10% TCA and then bring in the TCA salicylic, which if you look at your Baby Boomer peel and your Melanin Lift peel, they're very, very similar. The main difference is either 15% TCA and AHA versus TCA and salicylic. Really, you can cross-reference those depending on the skin, and you're still going to get a lot of movement and a lot of lightening or a lot of anti-aging effects from if you move 15% over and replace that in the Baby Boomer with the TCA sal. You can really use those and kind of move between. But we want to get a little bit of benefits from that AHA. With the 10%, we don't have to remove it. And so before I go into all the details of what we're doing, that way we can talk as we go, we're going to go ahead and get started. So Michelle, you can kind of start cleansing her and getting her prepped. And then we'll talk about the changes and why we're adding what and how we're doing it and what we're doing as we kind of move along. So starting out with our skin brightening cleanser, remember here, don't get so stuck on this prepping aspect when it comes to the cleansing. You know, anything we can do to kind of further target with pigmentation is great. So using the skin brightening cleanser. But if you only had the pumpkin cleanser, the Maui cleanser, or something like that, or even the beta green tea, you can use that here. All of those are really nice, active, that are going to give you a really good cleanse. But especially for her skin tone too, I think keeping with that skin brightening cleanser is really the key and makes a difference. So as we're kind of cleansing, do we have anything that, you can go ahead, just wait. Do we have anything, Aubrey or Caitlin, that you'd like to kind of talk about or add in, or what you're seeing at all with her skin or anything there?
Well, you know, I saw Lily almost probably like 5 days ago or so, and you can definitely see that beautiful refinement that's starting to take place in her skin from the modified mid-depth peel that we did on her for her last peel. And then the one very, you know, the spot near her eye, you can see that it has decreased in that darkness, and that it has lightened. And I think that even when we were talking last week, Lily said that she noticed with each peel that, you know, it gets a little bit lighter and a little bit lighter. And then the same thing goes on the other side of the eye tissue as well. It looks a little bit lighter too. But I really, like, when I saw her, I was like, wow, the skin looks amazingly smooth and soft and just very refined.
Yeah,
so.
And I think too, I feel like we've seen more lightening since the post-care follow-up. So I'm really thinking that that natural mega brightening serum is working really well with her skin. She's getting a lot of good cellular turnover with that increased, adding that chronopeptide. So that's helping on that vitamin A side, and then that naturel. So I think that's really good. We're seeing like progression even with her home care, which that's a really good signal and something to be watching for, is those changes along the way there. Because now we can realize that, okay, we're going to get so far with our peels, with our treatments, and sometimes when you do a peel, you see the effects of that 3, 4, 5 weeks in anyway, because there's so much remodeling happening underneath the skin, so many things taking place. But when we add in the home care, you've just got to realize how crucial that is to the success of the treatment. And we saw that really with every 90-day that we've been through, and we all know this, but to really understand that if someone says, you know, I want to do the treatments, but I'm not going to do the home care, you flip-flop that right around and you get them on the home care, because doing consistent home care is going to be their really success to changes in their skin and making a difference. Doing one peel or one facial is not going to do it. And so we would always kind of have that rule, especially if someone was on a budget. You have some really good corrective home care to work with that in some ways can be almost like a peel in a bottle to a degree. You can use them and recommend them in different ways to create what you can do in the treatment room to a certain level, obviously. You know, even having her use that natural mega brightening serum more often. We're just doing it every third night right now.
Exactly, and that's what I was going to say.
You can build up.
Look at what we're seeing from that home care, and we're not even utilizing that the product that is specifically geared for her pigmentation woo, to its fullest. You know, and we're already seeing that change. And, you know, and that's the thing, like you mentioned, the home care is such a key. I mean, it's almost like 80% of it is home care, and, you know, and 20% happens in the treatment room. And, you know, we all talk about post-care being so important, but getting them on a good home care regimen and, you know, within our line, we have those wonderful correctives that are really going to help to deliver those changes and in a very safe way for the client.
Yeah.
And specifically for hyperpigmentation, when we're dealing with this condition, we need to have that constant suppression of your melanocytes. If we're going in doing just one treatment every 3 or 4 weeks, she's really not getting the benefit that we're wanting to do over the whole 90 days. So especially with pigmentation, it's so important to have them on those home care products that are going to really give that nice suppression of the melanocytes, but then also helping to really stimulate the skin to encourage additional cell turnover to exfoliate off the cells that have already had that deposition.
Yeah, I think those two work in conjunction. And you could go with a stronger A if we weren't doing the peels and things that we're doing, where you put her on one of our stronger vitamin A's that really does cause that skin to get that exfoliation and kind of that mini home care peel. Just always being concerned with the post-care and the healing. And you probably have heard, and we might have talked about this in the anti-aging, we're not going to go into depths on vitamin A, but remember when you are using vitamin A, and particularly a vitamin A that we talked about, prescription strength, or even using some of our vitamin A's that cause the skin to get that peeling to it, or can be a little aggressive if you're using it every night, you've got to have them on good post-care and healing during the process, and it can really go together so that their skin continues to stay strengthened and you see that A performing the way that you want it to and not thinning the skin, which it really doesn't thin the skin, but those are the effects and what you kind of see sometimes when you go a little too aggressive at home particularly. But kind of that's another way that you could go, another route, sort of like, you know, thinking of pre-treating, but even on her regular home care, if she wasn't able to come in, you could go a little more advanced with her regular every day and have her use it 2 to 3 times a night, 2 to 3 times at night in a row, and then pull off of it and then go back. But what we're trying to do is we're trying to maintain minimal peeling and exfoliation and inflammation at home. That's what you want to do with most of your clients, particularly as you get into anti-aging, because that's going to help their skin to age more gracefully and better overall. But particularly with pigmentation and going through this program with her skin, if we were to put her on too much aggressive home care, what we would find is an overinflamed skin, not that healing that we're seeing on her skin even after doing 2 peels fairly close together, and now going into her 3rd peel 3-4 weeks later, you would see that. And so that's where you have to be really thinking and guiding and making those changes, and remember not to go too aggressive, because that will impede your results really. And so I know sometimes we want to, well, give me this, let me do more. And so our approach here with her home care was really to maintain, to get further results, but to not create any peeling at home or inflammation or exfoliation. And she's been doing really well. I mean, we might even be able to, after this, to do every other night with her, even with that, because she hasn't really gotten any peeling at home from this. It's not, you know, made her too dry, anything like that. And I think the chrono has a good, you know, part to play in that, because it is such a gentle, as far as the epidermis layer vitamin A, that it's really going to just do that A component. But yeah, so she's looking really good and very excited to kind of see the results after this peel.
Absolutely.
It's going to be great.
And you know, you brought up the point of inflammation, and when we're talking about pigmentation, you know, you really need to keep that inflammation at a minimal amount. And then if you are inducing inflammation intentionally, like we do in a peel, you know, having that post-care there, utilizing melanin suppressant or cell conditioner or different, you know, products to really help keep that pigmentation at bay and keep that inflammation from triggering additional pigmentation is key.
Yeah.
And you know, one of the things that I like to speak about when I'm doing my trainings, for especially on the retail aspect, is, you know, so many of our products contain wonderful anti-inflammatory, antioxidant support, all these great things to help really help protect the cells.
Yeah.
You know, and so we're able to maybe push the envelope a little bit more in the treatment room because of the fact that our home care is so well balanced and has that opportunity to really protect the cell.
Yeah.
And not that we're pushing it too much, but you know, we're keeping that moderation.
And especially working with your higher skin types, Asian and African American skin types, we have a tendency to have more transepidermal water loss. And so when you're using really aggressive ingredients and creating more inflammation, it basically impedes the skin from having the correct response, so our skin's not able to protect itself as well. So really making sure you're incorporating the home care with your darker skin types, that's so important. Just with the mechanisms of darker skin types, Asian skin specifically, you need to have those things in place.
Yeah, yeah, that's great. That's a real good point too. Do we want to talk about, I know that you were thinking about talking about a little bit of melasma and kind of just going through a little bit of that. Now would probably be a good time as we're kind of.
Yeah, we kicked around the idea of melasma as well as also environmental factors and pigmentation today too.
Yeah.
I know that Caitlin and I had talked about that yesterday for a little bit. But you know, when we're looking at melasma, which is something that we come across quite frequently and more so probably than ever due to the increased use in birth control, hormone replacement therapy, and so forth. And when you see women that are in their 20s and 30s that are coming to you and they have that melasma patch, which usually starts around the upper lip, is typically where they see it for hormones in females, but you know, it can happen anywhere on the face. Usually this is from those synthetic estrogens that they're obtaining through their birth control. These synthetic estrogens are creating types of inflammation, hormonal imbalances in the skin and in the body, which of course triggers inflammation, and an inflammatory response, pigmentation becomes worse. And you know, melasma is something that is very challenging to treat, and I think that that's something that we need to make sure that we really speak clearly to our clients about. The last thing you want to do is give someone a promise, oh yeah, I can take care of that pigmentation for you, no problem. And it's melasma, and it's very challenging. It takes a lot of time. You may be able to lighten it, but that doesn't necessarily mean that it's always gone forever. You know, if they stop their home care regimen, or they expose themselves to too much sun, or any kind of an inflammatory response could bring it back up to the surface. And then with that, on the flip side, when we're entering our 40s, 50s, and plus, and once again, us poor women going through our hormonal change again, we start to have that decreased level of estrogen and actually an increased level in testosterone. And so again, we're seeing that increase in inflammation and hormone imbalances, and that can trigger melasma as well. So, you know, not everybody gets it as the pregnancy mask. Some women sadly get it, you know, when they start menstruation or when they're on birth control or some type of hormone replacement therapy, and others get it in the menopause state too. So.
And they found in the last couple of years that there are more estrogen receptors found on the skin in patients that are suffering from melasma. So there's a definite link between using birth control or hormone replacement and melasma. And the key also is to really make sure you're knowing if you're treating melasma compared to pigmentation, because the heat that you can create with certain treatments or lasers or things like that can permanently damage the skin and make the melasma just really unbearable for some people. So being able to study what is melasma and what's more hyperpigmentation, and a lot of the times with melasma it's going to be symmetrical on the face. So it's going to show up on two different sides. Or it's going to be, like Aubrey had mentioned, more of the pregnancy mask kind of a look to the skin.
And you know, you brought up a really good point with the lasers too, because a lot of times they're under the assumption that the lasers are going to actually cure, you know, and totally remove the pigmentation from melasma. In reality, lasers actually don't necessarily have as much of an impact as one would think as well. So in some of the studies, yeah.
Yeah, I've said, you know, for many, 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 many years, and you know, Rhonda said the same, is that we would never really have someone go in and get laser for pigmentation. There might be other reasons to get that service, And, you know, that's, you know, not to discuss all of the laser things here, but for pigmentation, I wouldn't do it for the simple fact of the risk, the fact that typically it's not really getting rid of it, it's only suppressing it anyway. Many people that go in for pigmentation issues with laser, a lot of times they end up with hypopigmentation. We've seen that more and more and more when they go in for this one, and then all of a sudden now they've got both. They've got the hypo and the hyper still. And so that's really important. And what you can do, the best thing you can do is just say just that to your client. If they're asking you, well, what about this as a treatment? What about, I'm reading this, I'm finding out this. I would say, you know what, there's good aspects to laser and medical treatments in this or that fashion, and here's why I might recommend it, but for pigmentation, I wouldn't, and here's why. Explaining to them that it is a damaged cell. The melanocytes are now, we talked about this a few weeks ago, so don't want to kind of over-repeat everything, but you need to educate them on what the melanocytes are now doing. They are now overproducing in an area, depending on whether that's melasma, pigmentation, and whatever the reason is and whatever the cause is. Basically, your melanocytes are a process, are a part of that cellular turnover process and everything that's going on really healthy in our skin. And within those cells, the melanocytes are a part of that process. When they begin to overproduce, what happens is you see a darker color on the skin. Your pigment changes. You're getting too much of those melanocytes coming to the surface, and it's changing the color of the skin. When you do any type of procedure that we're doing today, peels and or lasers or other things, all we're really doing is suppressing it in many ways, beginning to disperse it out to some degree. However, the memory of that cell and that melanocyte really does not change. And that is the real key, is because as time goes on, as inflammation subsides, as your melanocytes are now able to, going back to their normal production, and now you're seeing that more clearly on the skin, and that can range 6 months, a year down the road, depending on the type of treatment. We can have inflammation in our skin just from a procedure anywhere up to 6 months to 9 months, and some even longer. And so you've got to know that that's really going on and happening within the skin. So most people that you see that they see, they got this great before and after, many times a year later it came back, and sometimes it came back worse. So explaining that, explaining what's going on, where with peels you're a lot more safe, because what we're going to do is we're not risking the skin to get hypopigmentation. We're not going to get that with this peel. We're not going to get more pigmentation. We're using a lot of safeguards there. We've watched her skin progress and how she's going to peel. And we're going to get that lighter look to the skin. We're going to get that pigment to kind of break up a little bit and give us some lightening. But if she never does anything else, and we see her in 6 months to a year, she'll probably have a lot of that pigment back on her skin. But the thing is with this, she's getting a lot of other rejuvenation that's going to affect her skin. And if you can educate her on keeping up with her home care and then doing some peels here and there in between, and every program is going to be different on how they need to do that and how many and what's going on. But that's only going to help their skin as they age. And it could be really light, progressive peels, and that's all they do. And they do that every 3 months or something like that, and that could really keep their skin looking the same and getting progress. And so when you educate them that way and explain the differences in the rest, and then they have to then make their choices from that point on. But that's kind of what you want to do. And so we always kind of say that is really for pigmentation, it's the one skin condition that I wouldn't just go running out there for laser. I'd really take some cautions and really look at my skin type and see how is this going to affect overall the rest of my skin. And then also, how is this going to affect me from years? Because as you know, and you probably see, just a minute before you go to the next step, many people have all kinds of things from too aggressive of a medical treatment. Sensitivities for, many, many years afterwards. Then, the hypo, which we talked about, hyperpigmentation. There's other things that can begin to happen. And so that's why you really want to make sure this is a condition that it can treat, and here's why, and here's the results, and not necessarily permanent, because nothing's permanent. But it's not going to be the same kind of risk. So that's what we would do, is really begin to just educate the consumer, because then they're going to make their choices from there. Moving on to what we've done so far. So kind of following that protocol, you've got the prepping, the cleansing with the brightening scrub, and then going into the cell conditioner and the melanin suppressant. What we want to do here is we're going to bring in the mandelic arginine peel, and we're bringing that in for a couple different reasons. We are going to use a component of an alpha hydroxy acid too, but we want to bring this in to continue to work on her skin, keep it responding, and I think this acid will be good and really kind of help to loosen up too, so she's going to get an even better peel, so kind of loosen up that skin that's still on her, that dead skin still on her. What am I trying to say?
It's going to help to lift
the dead
that
skin on her skin.
lift those dead
right.
skin cells.
The dead skin on her skin. Okay. So we're going to help with that process. And mandelic has a lot of components to it, which we've talked about in the whole complex there. Adding in that and hibiscus can really be valuable, one layer. Mandelic's going to be a little less in strength and not impede and take us even further than hibiscus would with doing all of the other acids we're going to do. So that's why we want to do that, and now you can kind of go right ahead and get that going. So that's a little change there. And then because we're going to use the 10% TCA and AHA, we don't have to remove it. Anything that's over 10% higher in an alpha hydroxy acid that is a pH of really under 3, and most of our pHs are 2.5 in these acids, under 3, you need to time and remove. So alpha hydroxy acids will continue to work on the skin. You've got to wash them, time them, and remove them with water. That's what you need to do with the 15% TCA and AHA. And so we're going to use the 10, and then we're going to go right into our salicylic. So we're getting a little bit of that AHA support and that lightening and lifting that can give us. And then our main acid will be the TCA sal. And as you've seen, you know, the technique pulling all the way back to the hairline, really using firm pressure and overlapping. That's really important in your peels, okay? So when you're doing peels, this part of it makes all the difference, okay? Making sure that you're really being methodical, that you're really paying attention to what you're doing, and that you're overlapping every area of the skin and using really good pressure, because you want to get a very even peel. You want to make sure that your acid, everything that you do here, we're still in prepping mode, so that our acid is really going to saturate even deeper into the skin layers, and you're going to get a nice peel. A lot of times when we're troubleshooting with peels, we find that the prepping is a big part of it. Some people will just skip that. They might just do a quick cleanse. You know, just cleanse really quick and then just go right on and think they can go right into the acid. You're not going to get the same effect. Some people don't use firm pressure, and we try to, you know, it's hard to know unless you feel it on your hands sometimes, but just remember that you don't want to be light. You don't want to be so heavy-handed, but you don't want to be light. You want to really lay and press that into the skin, and that will make a difference in the outcome as well. And then always making sure that you're overlapping so that you're getting good saturation on every cell and pore. And so then we'll go on. Usually with the mandelic arginine peel, people don't feel that. But remember, communication is real important in a peel. We've had people panic on the table over all the years of doing peels and seeing, you know, clients and models and things like that. And a lot of that has to do with your preparation and your communication to them. So you want to do that. With this one, she's not going to really feel anything. They already handed her the fan, which you can see. With this, you're just putting it on and letting it sit on for enough time to really turn around and get your next acid. And you always are watching for changes between every single layer. You're not going to see a lot with this, hopefully. So then going into the 10 TCA and AHA, and we're just going to do one layer of that and let that process on the skin. Okay, and you're doing good, Lily?
Yes.
Good.
I think that Lily was...
Wait, is she talking to me? Lily gets so relaxed.
She does.
And she kind of...
She gets very relaxed.
Okay. Falls asleep in this environment.
And Shannon, when you were discussing the kind of the memory of the cell and how it can, you know, keep its memory for an extended period of time and really start to reproduce pigment the way that it was before treating. The mandelic arginine, the complex that's in there, is really going to help with the cell-to-cell communication and also clear up some of that misinformation that the melanocytes receiving to overproduce melanin. So it's not just an inhibitor, but it's really
Yeah.
getting that skin strengthening, rejuvenation, but also helping with cell talk,
Yeah.
which is important too.
That is important, and you know, I kind of always go to stem cells thinking those are some of the answers, but learning more and more from Caitlin on pyruvic acid and phytic acid and just the complex in our mandelic, it really, you know, kind of opens up my mind to think, you know, I think we can even go further with that in making that kind of change in the skin where it becomes more permanent. Doing something like that maybe with a stem cell and, you know, that mandelic as a home care, I could see that really increasing that side of it, because your stem cells are going to help to sort of repair the damage, if you will, the DNA kind of structure damage that you get with our time as we age, or you know, from sun, or just all of these things, and that starts to break down in the skin and the body. And so between that and kind of thinking about that communication that begins to slow down or lack or miscommunication now that's happening between the cells is a really good maybe pairing a lot of times for this in a way. And those work so well on the skin, which is so great, because for a home care, neither one of those are really going to cause a skin peeling. You know, the elements are going to be good. They can go out and do their normal activities, and yet they're still going to be getting some progressive. So I love that. Thank you for, you know, even bringing that up further, you know, with using that too, and just the idea behind that. We need to get more research going now. It's got my brain going 100 miles a minute. What we can do. So is that hot, Lily? Yeah, and that's normal. The AHA component's a little itchy, and TCA's, you know, pretty warm. Her skin looks good. I don't know if you can see, we're getting a little erythema more on the forehead area. Nothing that's alarming or anything like that, but I do see more pinkness through there. And then everything else looks really good. I wonder why she's just getting pink through there. A little bit around your nose area.
My nose, right?
Yeah, your nose is getting
It's
more
stayed
pink too.
for a while.
Yeah, it looks good. How does it feel from a scale of 1 to 10?
About 5.
About a 5? Okay. So what you're looking for here and what you're trying to do is you're allowing this acid to process anywhere from 3 to 5 minutes. That's about the amount of time that you might see changes, that your skin's really receiving this, and you want to allow that amount of time to watch and see. You don't just go right into the next step. You could come and create some complications that way. We want to see if we see frosting. We want to see if we see any further erythema in the skin. We want to see if we see blotchiness. All of those things are really important here, and everything, you know, looks really good. And you want to make sure it's all saturated, so that you don't see any more solution on the skin. And then letting her use the fan as long as she needs to. If that takes longer, it takes longer. Typically, they're fine. She kind of keeps bringing it back up and down. But how's it feeling now? Like gone down a little bit?
It's
or
done now. It's just tingling.
just more tingly? Yeah. Okay, well, good. Yeah, everything looks real good.
She's like,
Give me
more
some-
tingly, but I will
give
put
me
the
some
fan
more
back.
On this side, it's more tingling.
More tingly on that side. Okay, no more fan? You're good? No, it's
She's like,
okay.
I'm okay now.
It all looks good.
Mm-hmm.
I don't know if you noticed, she did, I think I might have pointed out, she got a little breakout during this process. I'm wondering what that was, what maybe, and you know, some of that's just normal stuff. We have breakouts from time to time for different reasons. You didn't really have pigment there. Were you using that natural mega brightening serum just spot treating in your pigmentation, or were you using it all over? I think we'll go back maybe to spot treating. That could sometimes, I see that from time to time bringing up breakouts in the skin, and that was one thing that we kind of added here. And so that could be. I'm not totally sure, you know, 100% if that's what caused it, but I kind of have a feeling, kind of almost like a gut feeling, that that's a little too much for your skin to do that all over. So what we would do is maybe do it all over once a week, maybe just completely spot treat with it only, and just using her pigmented areas. So we can watch that and see, and then it could just be, you know, one of those things where, you know, it's kind of like breakout time to a degree. And we are creating a lot of stimulation, but I think if it was from any kind of purging or anything like that, we would see that a lot sooner. We would have seen that, you know, several weeks ago. So I don't think it's from anything there going on in her skin. So now what we're going to do is the TCA salicylic, and everything looks good to kind of do that. And we're going to at least do 2 layers. We'll see how her skin responds. That's kind of the goal here, is to at least do 2, and we might even do a 3rd. We probably want to see some frosting in some areas. We don't have to, though. That's not necessarily an indication that it's going to do better, but we probably will, and we kind of would want to see that in a couple places would be good. And we might go back up around her eye. I don't know if you remember us doing that with the Saki peel, the one that we did. It was the Modified Brighten Up to get those eye areas more with the Q-tip. But let's kind of go through the stages here and do our layers and then see how her skin does. Now this will be real hot, okay? You haven't had this acid before, and it's probably one of our hotter ones. So just know that, let her get it all the way on, and then you can bring that fan up, okay? And just relax.
It's really hot.
Yeah.
Just breathe through it.
Yeah,
in
take
through
some
the
deep
nose.
breaths and just relax, and you'll be able to bring that fan up. And this is hot. I'm telling you, it
It's
brings
supposed
tears
to
to
be.
my eyes. And I feel on, she's getting frosting all through her forehead. Take some deep, deep breaths and just relax. Just relax. And I'd like us to be able to zoom in when we can. Just keep relaxing. She's almost done. A couple more areas here. And you're doing good. Your skin's taking to it quickly, which is good. So I said we were going to do 2 layers.
Yeah, I was
Forget
gonna
that.
say.
Maybe even 3, but we're not doing any of that. This might be all you need, and then we'll go around your eye area. Good. Okay. And now just hold that fan. You can turn it up as high as you want. And just keep taking deep breaths and relax, and just let it sit on your skin. So she got really quick frosting on her forehead. You can see it pretty much everywhere. She's gotten frosting. So the more that we can kind of keep zooming in, just so that everybody can see that, there's no concern here, everybody, okay? There's no concern from a need to panic or anything like that. You do a Let's Prep on my skin. In fact, it's a very old video that we have. It's like back in, I don't even know, 2000 and something, 2 maybe. And you do 1 layer of this TCA Sal with not even as strong as a prep, and I am literally a full face frost. I look like I have a serious deep peel. It's like white all over. And you can see that in that video. And so, but this is normal. And I usually get a mid to a deep peel, when I do this. So all that's normal. What this is indicating is that her skin is really doing well and taken to the acid, which is what we want to see. That it's enough. We're not going to go over a frosted area. That's when you can get yourself in trouble. And you're just going to let this sit on the skin, let her sit there and hold this fan, and it can take anywhere from 5 to 10, 15 minutes if you needed to, because it will get really hot and everyone's pain tolerance is different. So you just let them kind of sit here, massage their shoulders, relax them, talk to them, let them know that it's okay. But I knew you were feeling that almost immediately. That forehead went fast.
It did.
So all that's good.
That's beautiful.
Do we have a question, Alyssa?
Yes, I see she frosted very well. How many layers can you do of the 15% TCA?
The 15%?
Or
Or the TCA that we just did?
the one that you just did, I'm sorry.
That's okay. So the TCA cell that we just did, typically we do 3. We can go up to 3, staying in the mid-depth range. A lot of times if we're going to use this acid and go deep, we're using some other components too and bringing in maybe another acid along with it. He's trying to, yeah. So thank you guys for getting this together. And yeah, that's great. I can really see that good.
Yeah, you can see the frosting right
And
in
if
there.
you want us to turn her head at all, we can, but that looks great, Valerie,
in the
George.
forehead.
Thank you for showing that. Just keep it on that for a minute. Let them see. I want you guys to know this is normal if you're going for it. Remember right before we applied it, we said we want to see some frosting. We want to get that. And so this is going to be a great, great peel for her. And
we were just
like
thinking it would take 2 to 3 layers.
yeah, we were just thinking to take a few layers because she really didn't get that on the Saki peel. And so it shows you the difference between 10%. Sometimes we think that's little, but it's a lot. And we, did some other stuff here and really preparing her skin. But it looks good. Is it calming down at all?
A little bit.
Like
On a scale of
what's
1
your
to
scale
10?
now? Are you over 10?
No, not over 10.
One day she said she was an 11 or something. No, what?
Where do
She's
you
used
think
to
you're
this
at?
pain now.
Yeah.
You can tell. What would you say it is?
It's about 7.
About a 7? Okay. Yeah, and with the fan on, so it's pretty hot.
It's really, really hot when
Yeah.
when we was
And getting frosting on the first layer like this is a real true testament to being able to pre-treat. A lot of the times you can't get frosting on your
Yes.
first layer, even at the higher percentage. So really making sure that you get that universal peeling. I mean, she's got very even frosting. It's not just in one specific area. So it really does show that pre-treating is something that's really important, and it can also get you the optimal peel you want without going too aggressive and too painful for the client.
Yeah, exactly. And the prepping that we did here
I was going to say,
makes such a difference.
Mandelic arginine peel, that 10% TCA, AHA,
Yeah.
and we left both of those on the skin.
Yeah.
It's not like they were removed, so
Yeah,
it's
so
real
good.
exciting.
So I think what we want to do, y'all, is we want to
Estheticians
get
love this.
this with the Q-tip. So we're going to have to hit that. And then let's look over here. And yes, see all this pigment, and you guys maybe can see it. I don't know if you, wherever you have it, George, it's fine. But I was just thinking, all through here we don't see frosting, and that's
No.
where a lot of her pigmentation
to
is
hit
too,
that.
that we want to get. So what we're going to do is we're going to Q-tip all of this. You could go back with your 2x2 gauze, but Q-tipping it we'll be able to really work it in there, and just only do it in those areas that she doesn't have frosting and that she has the pigment. And then that we could probably bring all of that up. And then that, and I think everything else looks pretty good. I don't want to get in the way of the, maybe even coming down, you know what I mean? Like all of this with a little bit more. And then and you still got to wait till she gets that fan off. Oh, and maybe a couple here, just right there. She's got a little slight frosting, but that looks good. And be careful when you do this to not touch the frosted area. So you just have to stay right on that. When you do something, and if you were to go over a frosted area, that's where you could get the risk of hypopigmentation, where you create almost that death of a cell, or you've gone too far. So we don't want to do that. You want to really watch and be careful. It's basically telling you that I've had enough here. What's going on? And remember, we're creating are you doing better? Because this is going to be hot, okay? We're creating an injury on the skin. It's a controlled injury. And so you just really want to be very careful of what you're doing. And like I said, making sure that you're not going too far by going over that area again when you see that frosting. And then we'll get this, yeah.
How you doing? You okay?
And the frosting you're seeing on the
You're
skin
gonna
is
get a good
basically the solution denaturing your proteins
Yes.
on the skin. So it's whatever protein the solution comes in contact with, it's basically pulling it apart or denaturing it. And when that process happens, that is what basically is destroying the cell, and that's what's coming up as that frosted look. So then if you apply peel on top of already frosted skin, then that's going to penetrate even further down, especially because this is a denatured alcohol base, past the areas that have already been denatured down into live tissue underneath there. And that's when you can get the necrosis of cells, hypopigmentation, and that's when you can kind of get into some scary areas.
Yes, and thank you for explaining it that way, because that's really what's happening there, and that's why if you go further, oh, nice. Okay, so we've got some good frosting on this area for her pigmentation. Do you need a fan at all again? Okay, go ahead and bring it up. we may, well, this is maybe getting some. We may not see it as much on this side.
Because let it go all around the
Yeah,
edge.
do you feel like, yeah, so it might be just leave it. Yeah, I know, me too. Oh, good. Yeah, this is what we want to see over there. Do we need to do it one more time?
That's what
we
I
need to make
think.
sure we're seeing good, guys. who's got the best eyes around here? On our
Well, I
map?
mean, you
Well, maybe
certainly
I'm
see it
getting some, but
around
it's
there.
not grabbing it on the pigmentation.
Or
Do you know
maybe
what
it's
that would
harder
be?
to see it on the pigmentation.
Yeah.
Yeah, because you can see the texture
It almost
change.
looks like it's taking it right around, but not.
But if you look at it up from this angle, you can start to pick up a little bit more of the whiteness and the texture change.
I do. Yes, Aubrey, I see what you're saying. It is. So it's frosted. We're just not
Yay.
seeing it because of the darkness of it too, and then just the way. But
That's
when you
great.
look at it from here, you can see that. Looks good.
That's
Good sport.
there.
To get it a little more.
Just a tiny bit.
Yeah. Yeah, I don't see frosting there. Yeah, we can just get that just a little, just 2 more little spots. And then, so then changes can continue to happen on her skin, right? We've been watching this. We didn't even go to a second layer. We just kind of spot treated it from there. Letting her sit with the fan, watching her skin, and then probably give it, excuse me, giving it a good 5 minutes. Is what you want to do, and then as long as they can pull the fan back before you do the vitamin A. Okay, I don't think we're double layering our vitamin A. We thought about
Not this
doing a
time.
double dosage of our vitamin A, and that can be really good sometimes and really accelerate. Whoa.
Accelerate.
Thank you guys. I can't talk today. Accelerate that peeling, but I don't think she's gonna need that at all. So just 1 layer will be perfectly fine for her, and work with what we're doing.
Oh, good, look.
Oh,
Oh,
good.
did it take?
So we got some frosting in those
All
areas. I don't
right.
know if you can
Oh,
really see that
beautiful.
part, but it looks like everything else. But what we wanted to do
Very
was
nicely
kind of get
done.
frosting, particularly in all her pigmented areas. And that first layer that we did brought up frosting in a lot of areas, but not in a few places. So going back with that Q-tip, and now really she's frosted everywhere we want her to.
How's it feel, Lily?
It's still okay.
On a scale of 1 to 10, would you say?
It's almost back to normal.
Oh, good. Oh, okay, that's great.
You're getting tougher as we go.
Yes.
If we would have hit her this one on the first one.
Whoa, she would have been. Yeah.
Which if you've, obviously those watching have probably seen all of the previous, and so you kind of know, everything was hot. I think even that first enzyme, it was like, woo! So she's getting to be a trooper now. Kind of got it all. Go on.
Well, and so to talk a little bit about what Caitlin and I had been briefly discussing yesterday, we see so much pigmentation issues in the treatment room now, and why now over the past, and there's several factors that come into play, and of course one of them being the fact that all of those baby boomers that were out there bathing in the sun, without the knowledge even of sunscreen, let alone sunscreen even being readily available, they're having pigmentation issues, a lot of it caused from sun damage. And then too, like I would also say, that some of the issues regarding birth control and the increased use of birth control, especially, nowadays versus in the past.
I think our environment too.
Well, yes, we
It's
just
changed
have
so
so many
much.
more environmental toxins,
Toxins and-
and then
yeah.
also now that we are more understanding of the damages of the sun, then we started getting into these very high chemical sunscreens. And
Yeah.
if you look at the way that chemical sunscreen is working, these chemicals basically absorb the UV radiation, and then they get really, really high in their energy sources and create a lot of heat,
Yeah.
which then in turn makes the pigmentation worse.
Yeah.
So we went from sunbathing to chemical sunscreens and are now really understanding now that we really need more of a physical block.
Yeah.
But those things combined have been able to,
Contributed
damage.
to what we're seeing. Yeah, those are just good thoughts and kind of what we are seeing, because there's so many people that's what they say, over 40s, and they're kind of like, oh, my issue's pigmentation, and they're coming in, and so to be able to deal with that and kind of understand why, I think too, even seeing a lot more broken capillaries and rosacea skin, which we're going to be doing our 90-day for rosacea next, and getting into that and why and what's really going on there. And it has some similar to do with some of that, with the hyperpigmentation, but just the environment, just other things and ways we've been treating the skin that we're now learning to make some changes for that. everything's good. So you haven't needed the fan for a little while. You're doing good? Okay, so now we're going to do your favorite, which is the vitamin A. So apply this right over there on top of the TCA salicylic, because all of this neutralizes. Now, you could remove this, and we do remove it sometimes at this frosted layer too, if we wanted to take this into a deep. So that's why we would remove it. With her Fitzpatrick, it's going to create too much heat, and it's not what we want to go for. So that is something that you can do from time to time depending on the client, and we will do that to kind of go into that next level. But with her, it does self-neutralize on its own, so it's fine, and we're just applying the vitamin A right over everything. Okay.
Do we have any questions out there?
Yes.
How many layers of the vitamin A peptide peel can you apply?
Probably at most 2. You could maybe do 3, but it depends on what you've done and depends on their skin and what you're trying to accomplish. I would say really 2 as the most I would do for the majority of your peels and the majority of your skins. Where you might do a 3rd layer or a 3rd application of vitamin A to really get that effect in the skin is if they haven't done any prepping, pre-treating at all, and they're not on a vitamin A, and or you're just doing the vitamin A series. So that's kind of your main component. You're getting more mileage out of what the vitamin A can do to strengthen that skin, increase that fibroblast layer, and just really kind of do what vitamin A does. So that way, in that scenario, you know, you could do the 3rd layer or the 3rd application. I don't know why I keep calling it layer. But here and in this level, you probably wouldn't want to do that very often, more than 2, and most of the time just 1 is plenty. This is going to accelerate her peeling time. It's also going to really be putting a lot into that fibroblast layer. And when we created that injury, and especially what you saw with the TCA Sal, everything underneath her skin is now kind of going crazy. I mean, it's responding. It's responding to this wound. And you've got the inflammation aspect that's happening, and all of those receptors are starting to kind of go, whoa, let's get up there and start healing this. Your collagen and elastin is starting to work, kind of that layer at the dermis in your fibroblast area, and starting to respond and begin to come to the surface with growth factors and hyaluronic acid and all these things that the skin's like, I need all this up there ASAP to you know, heal what's going on and to fix this. What vitamin A can do is really even put back into and give you more of those resources. And so it will help to accelerate the peeling too, and kind of lift those cells and let them go, if you will, as that dead skin's going to be kind of hanging on and just starting to exfoliate. The vitamin A will help that process, and then it can also just really add so much more to the skin for the total outcome and for the healing that happens. When we talk about, you know, just aging or just everything that's going on, we need a lot of the things that are at our dermis to be really full. We need that area to have everything that we have in our 20s, you know, and all of that fibroblast layer. And so when we use vitamin A and at this strength, it's just adding to that. So that's kind of one of the reasons, and one of the main reasons why we like to add it almost to any pill we're doing. Now, if you're doing a real progressive and you're not wanting to get that peeling and just kind of that rejuvenation and that firmness or something like that, there's times when you wouldn't. But in general, you're pretty much adding the vitamin A to most skin types and to most peels. And that's kind of why.
Yeah, and we highly recommend it. And, you know, if it's a protocol that doesn't call for vitamin A, you can certainly do vitamin A as an upsell or to take that peel more towards the next level. So if it's a progressive peel, adding that vitamin A, you know, more progressive plus, possibly even mid-depth, depending on what acid combination you used prior to.
It kind of jumps it up there in the peeling that you see. So it's not really, you know, adding more of like an acid solution necessarily to the skin, but you'll see more exfoliation in the skin. And that's why, like, if you're at progressive and you have vitamin A and it's not in the protocol, it is going to take you to kind of a progressive plus, where you're really going to see more of that full face peeling. So that's good. How are you feeling, Lily? With one eye open.
I can see that.
One eye peeking out.
You're right. Vitamin A is my favorite.
Aw,
It's
she
soothing,
likes the
it's good.
massage.
Yeah.
Thank you,
definitely.
Lily.
And you look great. I mean, your skin looks great, even going through, you know, and that was pretty traumatic in a lot of ways. And certainly for the skin to receive that and respond so quickly,
strong.
you know, it's like, whoa, what's going on? And then, you know, her own emotions and how she felt and having to use the fan, all of that, you know, just, you know, kind of taking that into consideration when you're dealing with clients and being able to offer the nurturing side too is really, I think, important. But because after even going through that, now you see her skin, I mean, she looked great.
Yeah.
She doesn't look like, you know, and some can look a little more red when they leave you. But I think if you are giving it, you know, a good amount of time, and then when you apply this vitamin A, they look really nice and healthy, and just, you know, they know you've had a procedure done, but nothing too crazy. So we're applying
Excuse me.
daytime.
Yes. Figure it's a little too early in the day.
I was
To
hoping
just
it
put
wasn't
her-
sunny out there. Okay, and then did we have a question over there?
Is there a product you could use in place of the vitamin A peptide peel, say if the client was sensitive to retinols?
Well, I don't believe clients are sensitive to retinols. Show me that one. You know, I know maybe people say it to a degree, or they might think it, but I think a lot of that has to do with
Formulation.
formulation, what's been out there, what they've used, different things, and so they're applying it to that. There could be, you know, maybe, you know, nothing's 100%, but in general, there's nothing really that acts so much like that with what we have at a peel level here. So, but I would really explore further if someone said they couldn't use A. It really explore further to what their experience was, what they were using, and find out more. You know, we produce A in our bodies, and most people can take that on the skin just fine. So, but yeah, nothing so much. Maybe a little.
Question?
Can you talk a little bit more about the peptide component in the vitamin A peptide peel?
I don't know if I can, because I need to look at my book. Can you, Caitlin or Aubrey, or do we have the book to talk about? What's the name of that peptide? I can't even think of what it's called.
The perfection peptide?
The perfection, but it's, well, we don't know the main name, but perfection peptide, that's
Yeah,
good.
and the perfection peptide actually helps to,
Exfoliate.
exactly,
Increasing
it helps to
exfoliation.
increase exfoliation in the skin. So we actually, you know, not only do we have retinol in the vitamin A plus peptide peel, but then you also have the perfection peptide. We also have the turmeric and the L-carnitine as well.
Yes. Yeah.
So, you know, with that combination, we're really going to see some nice exfoliation due to the L-carnitine, the peptide, and then, of course, the benefits of vitamin A really bringing those resources and
Yeah.
helping to rebuild those resources. Her
Definitely.
skin's looking great.
Mm-hmm.
She looks beautiful. I mean, like, it looks fabulous after that kind of a peel. And Lily, you were so good. You didn't tear or anything.
She's like, I wanted to. Teared silently. And so we put the daytime and then a little omega over. She's going to leave this on all day today, and then wash this off tonight before she goes to bed. And we'll talk about her post-care. That shouldn't take us too much time, really. We need to kind of get there. Are we able to change over to there, or should we just, what should we do from a camera standpoint?
We can. Do you want us to show
Should she go change? Yeah, you want to show what she looks like? and take-
when she gets up?
Yeah.
And then we'll just transfer over here
Okay.
while she goes and changes.
All right, sounds good. So go ahead and sit up and look over here at this camera, and they can see you.
Keep that hair back.
Keep that hair back.
I
Oh, looks
feel like I
good.
need to give her a clip. Whoa, keep that hair off the face. No, you're okay.
All right, so that looks good, and they can see your skin. And then why don't you go
Looks
ahead
really
and change, and then we'll talk about post-care. So post-care, what we had you on before was the citrus gel cleanser. We had growth factor serum and sea gems. Daytime defense for your sunscreen. And then the spray. Did you ever need the calming skin gel for itching?
Only once or twice.
Only once or twice. Okay. And I feel like all of that really worked well for you. I don't know that I would make any changes. How about from a dryness? Did you feel like you got too dry? Was the cucumber spritz and then kind of like the sea gems and all that enough?
Yeah, sometimes it's getting dry, so I put on the CGM, but I use a lot of the sprit.
A lot of the spritz. Okay. So she doesn't have, she doesn't have like therapy E maybe, or?
And you did go
So
through the
she
sea
may-
gems pretty quickly, so maybe another moisturizer.
Yeah.
Or something
Kind of,
to
because that's what I'm
substitute
thinking.
in.
Going this far, I think if she keeps using the sea gems every day, it might be a little too much. So I think she kind of needs some other moisture.
Yeah.
And she's doing the serum, which is pretty good for you. But I'm thinking therapy E maybe?
We could certainly do that. Yeah, absolutely.
Because we're staying away from drop of essence on your skin, just because we think in some ways that could, you know, cause a little bit of congestion. It could be something she could use just for a couple days. Maybe even the omega, the small omega, just for the first 2 to 3 days would be good. And then and then the growth factor serum with the sea gems instead
Yeah.
of therapy.
We could do that. Or even the hyaluronic serum.
Yeah,
But that may not be enough.
but that may not be enough. That's what I was thinking. I'm thinking either omega or therapy E. What do y'all think?
I think, well, actually, this is a good opportunity in a way to kind of get an idea of what your client would, what they would use, you know, because sometimes if they feel that something's going to be too oily, too heavy, or they just don't like the texture of it, they may be less inclined to use it when their skin really needs it. And so sometimes it's nice to be able to walk your client over to your testers, let them feel the 2 different growth factors, or the therapy E versus the omega, or something like that, and see which one that they feel, okay, no, I'm going to go ahead and I'm going to use this one, and I'll follow your directions. But I mean, I think that
I just
omega,
think she's going to get pretty tight.
she's going to
Kind
get
of,
real
that's
tight.
what I'm thinking.
And I think that the omega is going to be
And
a
we don't
little
want to go
better.
post-bomb, you know what I mean, for her at this point, which a lot of people you would do the post-bomb here. I think omega, it's a small enough one that'll just, and then you can just use a little bit continued with your growth factor serum, and you know, you'll have your sea gems, and if you need more moisture, you can let us know. But I think that's the route to go. So almost everything's the same. We're just adding that in for the
Exactly.
next few days.
And it may even end up being that that the omega, you don't even need to use it all over the face, but just in certain areas where you're real dry, you're very tight, or maybe where you're even a little irritated once you start to peel. So you may not even
Yeah.
need it everywhere.
So, do you have any questions kind of just on what you're going to go through? Anything else? Anything that you went through last time that you want to,
You're
when it
gonna
came to the peel?
Peel a
A
lot.
lot more than
You should get pretty tight and peel pretty good.
And the other thing too is when you go back to work today, you know, make sure, like, I hope that you're not doing any acrylics.
well, it's hard for me not to do it, but lately I don't wear the mask,
Okay.
so it doesn't. I try
Okay.
to keep everything off my face.
Yeah, especially for the next few days, because it'll just
Yeah.
create some irritation and potentially demarcation too, where you'll have unevenness.
Yeah.
And could
ever
she-
since the last peel till now, I rarely wear
Good.
the mask.
Okay. We appreciate that.
I think my lump would not appreciate it.
Could she apply another layer of omega if she is going to do acrylic, so it creates a little bit of a
barrier.
barrier?
Well, right now she'll have one right now because we just put omega on top, and that will create that barrier, and that should be good for the next several hours if you did have one. But that's a good point because the omega creates a barrier on the skin as well as helping with that hydration and moisture for her, and in this case helping to even penetrate our vitamin A. And so yeah, you could use that too, and that would be good. But I think you'll be fine. If you can just at least not use the mask for first, the next 3 days. And then, if you're really, really peeling like crazy, it'll kind of irritate that too. So then you have to see. But then you can start using the mask again, next week or whatever. Okay, well, I don't know if there's anything else to go through on post-care other than now working out her next treatment and when we'll see her. Did we find out on your schedule if you can do next Thursday or Friday at all?
Thursdays. Oh, next Thursday. What day is it?
That is the
What is that?
July.
Where's our phones? Our phones are our calendars.
Yeah, exactly. That would be
17th,
July 16th
16th.
or
17th. Could you do either one of those, do you think, with your schedule?
Let me get back to the shop and I'll give you a call.
Okay. So we'll announce that, and those of you, I know that so many of you have expressed to me that you're even finishing up the anti-aging 90-day, and so you may not be watching this live, but if you are, we'll be sending out the exact date and time, probably maybe by tomorrow anyway with everything, and so you'll get that. So we'll try for that. If that doesn't work, we'll try for the following week on that Thursday or Friday, I believe, but we'll look at the calendar too. I think Tuesday's going to be too soon, for you to come back, because I don't think you'll be completely peeled and healed today. That only gives you 6 days, and we can't next Wednesday for our schedule, so Thursday and Friday might work the best if we could do that. If we have to push it out one more week, we can. So when you get there, let us know and we'll talk about that. And then from there, what you want to do is have her sign her post follow-up, or not her post follow-up, I'm sorry. Have her sign her post-care instructions saying that she understands everything, that we've given her instructions, and she has everything she needs to do the peel. That sheet needs to be signed every time. Remember, that's for your protection, and you want to keep that in her file, and you want to have it dated. And so she signs that, and then pretty much you're ready to go from there, and then we'll write down for you, though, the additional instructions for your post-care. Okay? Any other questions? We're not going over all of the other, staying out of the heat and all that. We know that. We've kind of done that, which it makes it nice at this point. Once people have done peels, you kind of know the ropes, and, unless they have other questions, you don't need to go through that again. So I think that's it. Anything else y'all want to add?
no.
Okay. All right. So thank you so much for joining us, and we will see you in a week or two. Have a good afternoon. Bye-bye.